Hi, Dr. Keith. I'm Laura Hoffman with Intercom Radio Group. I've read and heard so much about you. What on earth makes you any different than anybody else that's in this kind of a field?
Great question, Laura. I have experience working with thousands of patients with different health conditions. Things like PCOS, diabetes type 2, gastric bypass, thyroid issues, and also a lot of people on medications. So I'm different is that we're going to customize a plan for each one of these people. That is very, very important to have that experience to get the customization for each one of these type patients.
Now, is there a certain thing that I need to know on why I would choose you over another weight loss? There's a lot of different weight loss programs out there.
Absolutely. We want to find the underlying cause why we can't lose this weight. Everything's not for everybody. We want to make sure you're in the right program for your health condition, your medication, or if you just want to lose 12 or 15 pounds. Everybody's different. We got to find that out.
Okay, Dr. Keith Amodeo, let me ask you this one question. I have high blood pressure. By me changing some of the health things that I have done as far as exercising, working out, but I need still to get to that next level and get my blood pressure down and make sure that all of my statistics when I go to the doctor are perfect. Can you help me with that?
Absolutely. Like I said, that's one of our main goals is to get off these medications. As we lose weight, change diet, introduce nutrimedicals, we can get off these high blood pressure, maybe not altogether, but hopefully a reduction of them.
Now, is this a program that it would be easy for me to follow?
It always has to be easy. That's what I tell patients. If it's hard, people won't do it. If it's too restrictive, people won't do it. You can't be out there counting calories, weighing food, or eating prepackaged food. This has to be real life. But the patient also has to make the fundamental change. They can't have me solve all their problems for them. They have to get ready to make that change inside so they can get the results that they want. It can't be done just by me, but they have to be ready as well.
Mm-hmm. Now, if I do a strong exercise program, is this something that I can do along with exercising to get the full benefits of your actual program?
Absolutely. I will never discourage exercise, but we don't require any. I have a lot of patients that can't. They have knee problems, back problems, or they might be in a brace or be too overweight where exercise is not even an option.
Is this a program that could be really beneficial to me?
Absolutely. And it always just doesn't have to be about weight. Just the other day, I had a patient come in and her husband came in with her. And he gave me a hug. He said, "Thank you for giving my wife back." It wasn't the explanation, all the weight that she had lost. She was feeling better. Her energy level was up. Sex drive was up. They were doing stuff together again. They just felt better together. And he was just so excited to have the girl back that he married. He came in and gave me a hug.
Oh gosh, that's awesome. Is it real costly or?
The cost is going to differ for everybody. Please don't call up here and call the front desk and say, "How much is it?" Because the front desk lady doesn't know. She's not a doctor. She's not going to diagnose you. That's why we make it really easy to come in, call, make an appointment online, because I don't know how much it's going to cost. People that are diabetic type 2 are different from somebody that wants to lose 10, 12 pounds. Everybody's different, and that's why it's so important to get that one-on-one time.
Is there a website I can go to and maybe get a little bit more information about it?
Absolutely. CollervilleWeightLoss.com, very simple. And you can actually make your appointment there, so if you're too scared to call, you can make your appointment online.
Okay, so I don't have to be overly overweight in order to do your program. It's more about health and wellness than it is just about losing weight. It's about feeling better about yourself and getting your self in a position to where you're just happy about being you. Is that correct?
Absolutely. Like I said, I will never get too focused on a scale because you can drive yourself crazy, right? Mm-hmm. But what I typically see is a patient feeling better, their clothes fit better, and especially with a female and male patient, actually, the more I see more people I've talked to over the years, the number one things they're suffering with is actually depression. They just don't feel good about themselves.
Yeah.
We get them on a program, they start losing weight, and they start feeling better about themselves. They forgot how much they were suffering or how sick they really were or how bad they really felt until they start feeling good again. And that's really important, and that has nothing to do with a scale. Most people are just ready to change and tired of feeling sick and tired and feeling like crap. But one thing I do want to bring up, especially we're talking about a female patient, sometimes the weight won't be as dramatic as a male patient. Mm-hmm. And that's why we use something in the office called red light laser, especially on a female patient, because it's going to help with their dress sizes. And it's going to make the clothes come in, make them fit better. Because when they lose 10, 20 pounds, they actually look like double because it's more of a body transformation for them. So I really love using that red light laser therapy to make those clothes fit better, get that body transformation. And that's another thing that makes our clinic unique and different from others as well.
What exactly is a red light?
Red light laser therapy is basically causes what we call lipolysis. Lipolysis is just a fancy word for opening up fat cells. So what's going to do, open up the fat cells, we flush them out through urine or sweat, and it's going to make your clothes fit better. And the females really love that because, like I said before, a scale's never going to be as dramatic as a male patient or somebody that's younger. or somebody that has less health conditions. So we want to make sure we're getting that body transformation as well.
So you have a series of different opportunities for me in what you do, not only weight loss, but healthier ways and laser treatment that would also help to magnify that.
Absolutely. Like I said, we want to come in at all different angles, and especially depending on the patient's health history as well.
So what would you advise for me? How would I get started with this program?
Absolutely. The best thing to do is always call, schedule no charge consultation. But like I said, I know people, it's hard to call in, especially when you're calling in a weight loss clinic, actually a health clinic, but just go online and make an appointment. Easy enough.
Now, to get a consultation, is that costly or?
Consultation is at no charge. I'll talk to anybody for free. I'll go over their health history free. I just want to make sure we can help them first. There is some cases we might not be a help, or we're not on the same page or have different goals. And that's why it's so important to sit one-on-one with the patient.
Perfect. How long is a consultation?
Usually 10, 15 minutes, doesn't take long.
Okay,
and
so
it just depends on how in-depth the health history has to be.
Oh, Dr. Keith, I know you could probably help me lose it, but how would someone keep it off once they lose it?
Absolutely, great question. While we're here, while we're losing this weight, it's an actual retraining process, because it's great to lose a bunch of weight. That's exciting and fun, but the ultimate goal is to keep it off, and that's why we're here.
So let me ask you this one question, Dr. Keith. I mean, I have friends that, are afraid to take that first step. How can you make that easy for them?
Right, we can't live in fear anymore. If you're at home, sick and tired, don't feel good, low sex drive, whatever, poor quality of life, you have to call. It's time to make a change. You can't go on living this way. We make it super simple. We come in, we talk. This is what we do. We've been doing it for a long, long time. You're not alone out there. There's millions and millions of people struggling with the same issues, but until you take that step and decide to change, nothing's going to happen. I can't help you. I can't come to your house. I wish I could, but you have to be here so I can help you, get you feeling better. And like I said, we'll get weight off, but maybe focus on those other things that we talked about as well. Just the quality of life issue needs to go up really quickly. You can't just sit at home anymore doing nothing.
Reason number 251 to come to Dr. Keith Amodeo.
I like it.